Thank you, Fayaz. Our stroke app resides on port 8888. So I'm navigating to localhost 8888, which brings us to the login page. And first, we'll upload the post discharge stroke survey as an admin on our app. So I'm going to upload it the uh, from the app where the questionnaire is saved. So that's our stroke questionnaire. Once I upload it, it is going to get saved in our, it'll persist in both the app's local database and as a new resource in our Fire service. We plan to extend the functionality of this admin to support multiple questionnaire files and manage survey admins and destinations of patients. Once we have the survey uploaded, a survey administrator can then log in to see which patients they need to survey and actually perform the survey. We have created some survey admins assigned to different post-discharge facilities. We are going to log in as Nurse Jane. This is our homepage, which lists all the patients assigned to Nurse Jane to complete the questionnaire 30 days after they've been discharged for a stroke encounter. These patients are retrieved by a trigger service we talked about earlier, which will query the Fire service asynchronously to determine if a patient has been discharged after being hospitalized for a stroke. And this is done based on known ICD-10 codes. After they're retrieved, they're loaded into the application database, which is where we are retrieving this data from. So this lists all the patients assigned to Nurse Jane, and the list contains a sortable, this is a sortable list which can be sorted on patient first name or the number of days they've been discharged in. And this is done by just clicking on the table column header. So the questionnaire column shows the questionnaire icon for the patients for whom the questionnaire needs to be completed. If they're completed, we see a response. This response is the ID generated when a questionnaire response is submitted to the Fire service. So let us go ahead and complete a questionnaire for Fred Flintstone. Once we click on the questionnaire icon, this brings up the questionnaire form, which is one of our key innovations. This form is dynamically created, which is not dependent on a predefined structure. So you can always change the base questionnaire and upload it to the app without having to rebuild the application. And these questionnaire resource is of a Fire standard JSON resource. Currently, the UI form supports up to 2 nested levels. For instance, if I select a patient who smokes at the time yes, so this is a nested level which is dependent only on the question yes. So if I put it as no, the questions disappear. So I'm just going to answer a few questions here. I'm also going to show you, these are our pre-populated fields which were required, which is the hospital discharge and the admission date for that patient. And I'm going to try and show you a date field. So I'm just filling out a few more questions. So if this is a date field which is also dynamically rendered on the form, which allows you to select the date. And we also have a slider which is used to select blood pressures. And this is also dynamically rendered depending on the type of the question. The type is a specific it's a specific type according to fire standard. Now, once we have the fields filled out, we can scroll back up and submit the button. I mean, or cancel, and then it'll take you back home. So I'm going to submit this response. Once we have it submitted, we have a resource ID, a response ID generator for Flex Flintstone, and you don't see the question mark anymore. Now, this is also saved onto the Fire service. So I'm going to show you the response in Fire. So that's the response ID. Our Smart on Fire is residing on localhost 9080. So I'm going to do a quick call to that particular response, and you will see the JSON. So that this demonstrates that the response has been saved onto Fire as well. Now, even within our app, we can always have a preview of our JSON response of the questionnaire which we have filled, and this can be downloaded as a CSV or as a JSON. So let's say we are going to download it as a CSV. So that is your CSV formatted response. We can also hide the preview by just clicking on the response ID again. Some of these fields are not filled out because it hasn't been 30 days since the patient has been discharged. And this is our workflow for the app, and thank you for watching it.